Substance use disorder is one of the most stigmatized conditions, where not only is the patient stigmatized, but the disease is stigmatized and also the treatment is stigmatized. And stigma is one of the major barriers for treatment gap. So how can we help? How can we help the people who have substance use disorders? By changing our language in which we describe them. So here are a few ways in which you can help those around you better in order to seek treatment and to get better. So here's changing how we all talk about addiction. So instead of calling someone as an addict, you can call them as a person having a substance use disorder. Instead of substance abuse, you can use substance use. Instead of calling it a problem, you might want to call it a disease. Instead of calling someone as clean or dirty during their treatment results, you might want to call them being positive, negative, being stable, or being abstinent. And instead of calling a treatment failure, you might want to call it as a treatment attempt instead. So our role in the life of a patient who is suffering from substance use disorder as healthcare providers or as their family or friends is not to cast judgment or cast blame. Our work is to care for them, to provide them with proper health facilities, to help them better and to achieve their goals, to keep them involved in health care basically. So the next time when your loved one consumes a substance again, instead of saying, oh, you're using it again, you might want to shift the focus to just sitting down with them and talking about their day, just letting them know that you are there for them, asking how their day was, is there anything that is worrying them, or if at all they think that they need some help, you're ready to accompany them, and basically that you're there for them. And if you're a healthcare provider and your patients come back to you for a follow-up and gives a positive history of substance use and positive reports, tests as well, so instead of just calling them off and making them feel guilty about it, you might want to say things like, I'm so happy that you came in again. Can we just discuss how to keep you safe and improve your health even more? And always remember, addiction is a very strong word. So before you use it for yourself or for anyone else, make sure they are professionally diagnosed with the proper diagnostic criteria set in place for each of the disorders which are known as substance use disorders rather than addiction. So this is how we can help those with substance use disorder better by just changing our language and attitude towards the condition. We can help more people seek help, we can destigmatize the condition, we can help more people stay in treatment, and we can help more people in treating the condition and reversing their condition better and faster.